Welcome to this week's Milton Keynes Council COVID-19 update. Over the last fortnight, 3,725 tests have been carried out and 29 people have tested positive for COVID-19. The rise in cases means that Milton Keynes now has a case rate of 8.9 cases per 100,000 population, a rise from just 2.6 last week. For comparison, Luton's case rate is 25.8 and Bedford's is 11 per 100,000. While the total number of positive cases is still low, the increase is concerning. This is why we issued a warning earlier in this week, highlighting this increase and how it is essential that people still follow all the rules. That means staying 2 meters apart from people if you can, washing your hands on a regular basis, and wearing a mask or face covering in most public indoor places and on public transport. If you have symptoms, stay home and get tested. You must also stay home if you're asked to do so by NHS Test and Trace. I know some people are asking why we still need to do this if our numbers are so low, and thankfully we have not had any COVID-related deaths for some time. I understand some people are fatigued and want to return to normal. However, our low numbers must not mean we become complacent. COVID-19 is highly infectious. The number of positive cases recorded by tests is lower than the actual number of cases in the community. Even with comparatively low numbers today, the virus can and will spread quickly if we don't follow the rules. More people will become sick and more people will die. That can be prevented. There is still a responsibility on us all to stop the spread. Most cases have mostly been in young adults, particularly people in their 20s and 30s. And they've been spread across several areas of Milton Keynes, not just in one place. I must therefore say this: if people continue not to follow the guidance and cases continue to rise, it is highly likely that restrictions will be reimposed here. While many people with COVID-19 have no symptoms or very mild symptoms, it does not mean you cannot pass it on to other people, and it does not mean if you catch it, you will not be a serious case. If you don't feel well, you can arrange a test on the NHS website or by calling 119, no matter how mild your symptoms. I'd also like to remind you that the isolation period for people who do have symptoms has changed. It is now 10 days instead of 7, and that's from the date of your first symptoms or from being confirmed as a positive case. It is 10 days even if you feel better after the first few days. Please help us control COVID-19 in Milton Keynes. The last thing we want to do is put local restrictions in place or have them imposed on us for a more serious outbreak. However, we will not hesitate to do so if we think it will save lives, and if these early warnings do not help control the spread. I hope to have better news to share next week. However, until then, please stay safe and play your part. Until next week, thank you and goodbye.